Ever sat down to study, and before you know it, you're scrolling TikTok or gaming with hours gone? For most people, that's procrastination. But for Liam, it's something deeper: ADHD. This is Liam, a 20-year-old college student. He's smart, creative, and witty, but his brain feels like it's juggling 10 tabs at once. Some days, he feels unstoppable. Other days, even simple tasks feel impossible. Assignments pile up, laundry half done, deadlines missed. Friends joke he's careless, but Liam knows he's trying. ADHD makes starting tasks hard, finishing them harder, and remembering them hardest of all. ADHD, Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder affecting brain networks that regulate focus, self-control, and planning. It's not a phase or poor discipline. It's hardwired into brain chemistry. ADD, Attention Deficit Disorder, was the older term for inattentive symptoms. Today, everything falls under ADHD, which has 3 types: inattentive, hyperactive impulsive, and combined. Liam has the combined type, distracted and impulsive. Brain imaging shows ADHD involves reduced activity in the prefrontal cortex, the area that manages focus, working memory, and impulse control. Think of it as the brain's CEO struggling to keep staff organized. ADHD also involves dopamine and norepinephrine. These neurotransmitters regulate motivation and alertness. In ADHD brains, signals are weak. Boring tasks feel unbearable, while stimulating ones cause bursts of hyperfocus. It's not inconsistency, it's chemistry. ADHD runs in families. If one parent has ADHD, there's about a 50% chance a child will too. Environmental risks, prematurity, lead exposure, prenatal alcohol can increase severity. Worldwide, 5 to 7% of children and 3 to 5% of adults have ADHD. Many never get diagnosed, especially adults who think they're just bad at focus. Myth: ADHD is laziness. Fact: ADHD brains work harder just to keep up. Myth: kids outgrow it. Fact: 70% carry symptoms into adulthood. Myth: ADHD is rare. Fact: it's one of the most common mental health conditions. Inattentive ADHD looks like losing items, forgetting plans, daydreaming mid-task, or leaving projects half-finished. For Liam, it means missing deadlines even when he cares deeply. Hyperactivity isn't always running wild. It's restlessness, fidgeting, tapping, constant movement, or blurting out without thinking. Sometimes it's the mind that can't sit still. Most people, like Liam, have the combined type. Distractibility collides with impulsivity, 2 storms meeting at once. In adults, ADHD shifts form: poor time management, unstable jobs, risky spending, impulsive driving, or strained relationships. It hides behind labels like careless or irresponsible. Diagnosis isn't one test. It's a careful assessment: history since childhood, symptom checklists, school or work reports. The key is consistent patterns across multiple settings. ADHD doesn't lower intelligence. In fact, many are gifted, but inconsistency, acing one test, failing the next, hides their potential. Liam's professors see brilliance, but also missed essays. Forgetfulness, zoning out, or blurting things can strain friendships. People misinterpret ADHD as disinterest, when in reality it's working memory glitches. Years of being told, "try harder," lead to frustration, shame, and anxiety. Many adults with ADHD grow up believing they're failures when they were simply undiagnosed. Up to 70% of people with ADHD have another condition: anxiety, depression, dyslexia, substance use. This overlap complicates diagnosis and treatment. After missing another essay deadline, Liam's professor suggests he see a doctor. For the first time, Liam realizes his struggles may be medical, not moral. Stimulants are first-line ADHD treatment. They include methylphenidate, Ritalin, Concerta, and amphetamines, Adderall, Vyvanse. They work by boosting dopamine and norepinephrine in the prefrontal cortex, improving focus, working memory, and impulse control. For many, the difference is night and day, like cleaning a foggy window. But stimulants aren't perfect. Common side effects include loss of appetite, weight loss, difficulty sleeping, and sometimes mood swings or irritability. Doctors often recommend dosing earlier in the day to protect sleep and monitoring growth in children. Because stimulants improve focus, they're sometimes misused by students or professionals chasing productivity. Abuse can cause dependency, heart problems, or anxiety. That's why doctors carefully screen and monitor prescriptions. In ADHD brains, stimulants normalize function. In non-ADHD brains, they overstimulate. For those who can't take stimulants, options like atomoxetine, guanfacine, and clonidine exist. They act on norepinephrine or calm hyperactive circuits. They're slower, but safer for people with heart risks or substance use concerns. Medication helps symptoms, but therapy builds skills. Cognitive behavioral therapy teaches organization, time management, and emotional regulation. ADHD coaching gives practical hacks, timers, planners, breaking tasks into small steps. Lifestyle matters too. Exercise boosts dopamine naturally. Sleep regulates attention. Protein-rich meals stabilize focus, while sugar spikes worsen symptoms. Small changes, like bedtime alarms or setting study timers, make ADHD brains run smoother. Schools and workplaces can help. Extra exam time, quiet testing rooms, digital reminders. These aren't shortcuts. They simply level the playing field. After starting treatment, Liam notices real change. He still struggles sometimes, but now he finishes essays, keeps up with classes, and feels capable. For the first time, his potential shines through. ADHD isn't just challenges, it comes with strengths. Creativity, resilience, passion, hyperfocus on meaningful work. Many innovators, artists, and entrepreneurs have ADHD. Different wiring creates different brilliance. Liam's story proves ADHD is real, manageable, and nothing to be ashamed of. With the right support, people thrive. If you found this episode of Medical Minute helpful, like, subscribe, and hit the bell.